Hi, and welcome to How to Read Your Medicare Summary Notice, part of a 2021 Medicare Information video series sponsored by the Milwaukee SHIP Collaborative. My name is Ingrid Kundinger, and I am the project manager for the Wisconsin Senior Medicare Patrol program, a member of the Milwaukee SHIP Collaborative led by Milwaukee County. The collaborative brings together federal, state, and local agencies to provide you with timely, accurate, and unbiased information about Medicare, programs to assist you with Medicare costs, Medicare appeals, and Medicare fraud prevention. Our program, the Wisconsin Senior Medicare Patrol, focuses on educating people about Medicare fraud and how they can protect themselves from it, detect if it has possibly happened to them, and report any concerns. Today, I'm going to talk a little bit about how to read your Medicare Summary Notice. So the Medicare Summary Notice is a statement, not an invoice, but a statement that is received by Medicare beneficiaries on a quarterly basis. So in the mail, you would receive every 3 months, if you've been seen by a healthcare provider in that time period, your Medicare Summary Notice. Now, if you take one thing away from this video today, I'd really hope that you decide that you're going to actually look at these statements because it's really, really important. Oftentimes we hear people say, yeah, I know I get something from Medicare, but I don't ever look at it, or I'm not really sure what it is, so I don't really pay a lot of attention to it. It's really important that we pay attention to that because that is going to be the accurate or hopefully accurate description of your healthcare and Medicare coverage. You want to make sure that that's an accurate reflection of your healthcare and what your Medicare benefits have covered for you. So that's why it's important. If there are things on there that don't make sense, that are suspicious, maybe there's an error, maybe there's some fraudulent activity, if we're not looking at that statement, we're never going to be able to ask those questions and get the answers that we're looking for. So please, if you take one thing away, promise me that you're going to look at those statements. Now, they can be a little bit confusing, I will say that, but once you get in the habit of knowing what you're looking for and what information is on what page, I think it'll be a little bit more easy for you to understand that information. And it's a good habit to get into in terms of looking at that on a regular basis. So it's multiple pages, so just be prepared that there's multiple pages in that envelope for Medicare. The first page of your Medicare Summary Notice is going to be the dashboard. So it's just going to be the high-level information, your contact information, the date range for that Medicare Summary Notice, providers and facilities that provided you with care during that time period, and a few other pieces of information. So page 1, dashboard. Page 2 is more of a general informational page. It's called Making the Most of Your Medicare. So on this page, there's going to be information from Medicare about preventative services and screenings that Medicare provides, other information about Medicare benefits, where you can get help, all of those sorts of things. So just general public service announcement information from Medicare on page 2. Page 3 and subsequent pages that have claim information are going to be your claims. So this is the part that you're really going to want to look at and make sure that it's an accurate reflection. The dates match, the providers match, the service descriptions make sense. On these pages with the claim information will also be the outline of any charges that were submitted to Medicare. Did Medicare approve or deny that claim? What amount did Medicare pay? And what amount might you be responsible for, or a supplemental insurance policy? Again, remember, it's a statement, it's not an invoice, so it's just some information. There's also additional explanations given on that page with the claim information about if it was denied, or if there are other information. There's going to be additional footnotes on those pages that have further explanations of that information. And then the last page finally is going to be how to handle denied claims. So if there's something on there that's denied or that you have questions about, that last page of your Medicare Summary Notice is going to outline what you can do, who you can contact, what the format needs to be, what the timeline is for you to take care of that. So all of that information is housed there. So lots of important information is included in that. So I just want to cover a couple more things here. So what are you looking for when you're looking at your Medicare Summary Notice? The most important thing is you're looking for accurate information. Visit dates, providers and facilities that are familiar with to you that you've actually visited, service descriptions that make sense. So did you really get the flu vaccine? Did you really have blood work? Were there x-rays? Was that really what happened on that date with that provider? And then the payment amount information. So red flags would be if you're looking on your statement and there's a provider name or location that's not familiar to you. So let's say that you live in Milwaukee and all of your healthcare providers are in the greater Milwaukee area. It would be a red flag if you opened your Medicare summary notice and there was a provider that had submitted a claim with your Medicare information from North Carolina, especially if you didn't ever visit North Carolina or receive healthcare from a company in North Carolina. So just wanting to, those kind of things hopefully will stand out to you as being like, I might need to ask some more questions about that. You're also going to want to look and see if there are things that are on that statement numerous times where you double billed for the same thing that Medicare just paid for. You're going to want to ask questions of your provider, or you want to ask them to get that corrected so that Medicare only pays the appropriate fees one time versus multiple times. And then lastly, being on the lookout for services that weren't ordered by your healthcare provider or services that you didn't receive at all, that are just slipped in there, maybe suspiciously, hoping that no one will catch it. And you know what, if you don't look at your Medicare summary notice, or if we don't look at those statements from the insurance companies, we're never going to know. So that's why it's super important for you to look at that information. I know that was really quick, and there's a lot of other information we could have talked about. If you want to reach out to me to get some more information, I'd be happy to talk more about that with you. Here's information about how you can contact the Wisconsin Senior Medicare Patrol. We have a toll-free helpline. That number is 888-818-2611 for more information about that. And finally, I want you to keep in mind that there are Medicare savings programs which can help you pay your Medicare premiums, deductibles, and co-payments. These programs can help you keep more money in your pocket and balance your expenses. To learn if you are eligible, call the Aging Resource Center at area code 414-289-6874. Again, that telephone number is area code 414-289-6874. Thank you so much for joining us, and we hope that you'll join us for future video presentations as well. Thank you.